Debbie Case Study, presented by Katelyn Eckert. Deb is a 56-year-old female with a diagnosis of major depressive disorder, generalized anxiety disorder, and complex post-traumatic stress disorder. She currently takes medication for mental illness and sees a psychiatrist. Deb reports a history of violent assaults on her, causing her to have post-concussion syndrome. She also reports a history of alcohol abuse, but has been sober for 27 years. She has a history of childhood trauma. Deb also reports that she has arthritis. Deb has experienced frequent homelessness and reoccurring domestic violence situations when living with roommates. She attended school through her junior year of college and has worked several jobs. Much of her time spent during the day is getting to and from the center using the bus to attend mindfulness and AA meetings. Leisurely activities she enjoys include working with animals, being a part of her church, and going to the library. Strengths. Deb has a history of living independently and engaging in IADLs. This is helpful for her ability to successfully live alone since she has previous experience and is now living in a more stable environment. Since Deb was capable of engaging in IADLs previously, she will have the background knowledge, and with compensatory strategies provided, she has an increased probability of engaging in IADLs again. Deb enjoys daily structure with a routine and is motivated to continue staying sober. She has been sober for over 27 years and expresses no desire for drinking again. Her structured routine helps her to stay engaged in meaningful occupations and leisurely activities. Concerns. Difficulties with cognitive processing due to mental illness and post-concussion syndrome. This will negatively impact her ability to engage in everyday tasks without assistance or compensatory strategies. Deb has poor emotional control and limited coping skills. This can impact all of her occupations and puts her at risk for maladaptive coping mechanisms. Cognitive abilities such as Deb's ability to use problem solving and judgment for engaging in all occupations. Emotional regulation because of her conditions including anxiety, depression, and complex post-traumatic stress disorder. Organization and time management for improving her ability to maintain a job and safely budget her finances for increased independence. 2 frames of reference. Rehabilitative. This frame of reference can be used for individuals with cognitive disorders such as brain injury that causes performance difficulties. The rehabilitative frame of reference focuses on maximizing the individual's performance in occupations through adaptation of the environment or activity. Occupational adaptation frame of reference. This frame of reference focuses on the adaptation process when an individual faces occupational challenges. It focuses on the person and occupational environment. In the case of Deb, the focus would be on the cognitive aspect and the interaction with the environment for engaging in leisurely activities, work, and self-maintenance. Coleman Evaluation of Living Skills. This assessment uses a top-down approach and measures a client's ability to live independently at home. It is utilized with cognitively impaired adults. It includes ratings of 17 tasks, assessing areas including but not limited to safety awareness and money management. Bottom up, Cognitive Assessment of Minnesota. This assessment evaluates several aspects of cognitive disabilities. For Deb specifically, it would be beneficial for assessing following directions: problem solving, memory, and judgment. 2 occupation-based outcomes. To increase Deb's independence with IADLs by modifying her environment to improve executive functioning skills such as organization and planning skills with use of written lists, example, grocery lists for shopping. To increase awareness and understanding of different coping mechanisms to utilize for improved emotional regulation. Long-term goal 1. Client will successfully purchase 5 out of 5 summer clothing items of choice on non-simulated website using written list and minimal direct verbal cues in 3 weeks. Long-term goal 2. Client will create a weekly budget with prepaid debit card for improving independence with budgeting income with mod direct verbal cues in 2 weeks. In order to measure the goals, we can look at the level of assistance required in order to successfully complete the task in the time frame given. For long-term goal 1, the goal is for Deb to require decreased amount of direct verbal cues to monitor progress with problem-solving skills with the use of reading from a list and utilizing a computer website. If Deb is currently requiring mod direct verbal cues, this goal is monitored to see if she can complete the task with less cueing from the therapist in the time frame given. For long-term goal 2, Deb was given a goal with an assist level of moderate direct verbal cues because it is a new goal and activity that has not been established yet. Because Deb has only recently been educated about a prepaid debit card by the occupational therapist, she has not yet learned how to budget with it. A commonly used format for writing measurable rehabilitative goals is the set of 5 SMART criteria that can be used to plan out an effective goal statement such as specific, measurable, achievable, realistic, and time-related. SMART criteria prescribes the structural components for writing or formulating a goal statement. Long-term goal 1. Client will successfully purchase 5 out of 5 summer clothing items on website from written list with minimal direct verbal cues in 3 weeks. Intervention strategies based on client's meaningful goal. Patient will learn to navigate a real-life online website instead of simulation. Patient will also increase understanding of wearing appropriate clothing for weather. Patient will increase understanding with budgeting and independently using prepaid debit card. Type of OT intervention. Training, concrete skills for meeting skills in real-life situations with emphasis on the client's performance and mastery of a task. Education. Client will be educated for increasing knowledge and information to enable the client to acquire improved routines and participation in occupations to maximize independence. Approaches to intervention. Establish. The client will establish a new skill by navigating and learning how to utilize a website that is not a simulation. Modify. The client will utilize a weekly budget plan to help with organization and planning for spending money with the use of modifications such as cues from the therapist and creating lists to simplify the task.